Resuming debate.
The honourable member for Surrey North.
Thank you, Mr. Speaker. Today I'm honored to have the privilege to speak to this incredibly important bill on behalf of my constituents from Surrey North. This bill was put forward by my colleague from Laurier St. Marie. This Bill C-38 is an act to amend the Patent Act, basically the drugs for international humanitarian purposes, as it is known as Medicines for All. Mr. Speaker, if passed, this bill would ensure that affordable treatment for diseases such as HIV, AIDS, malaria, TB, for the world's poorest who are suffering and dying without treatment for these and other diseases because they cannot afford it. Mr. Speaker, one child dies every 3 seconds in the world for the want of quality treatment medicines. 1 in 2 children born with HIV will die before their 2nd birthday. Mr. Speaker, in sub-Saharan Africa, 22 million people are currently infected with HIV/AIDS, and that area is the hardest hit by this pandemic. This is 68% of the global total, and with 90% of the world's children patient with HIV/AIDS. Also in that region, Mr. Speaker, HIV impedes maternal health and is responsible for additional 61,000 deaths of mothers per year. Only 1/3 of the patients living with HIV/AIDS who need treatment receive it, and children are the most underserved group. Mr. Speaker, we know that Canada's access to medicine regime, known as CAMR, is broken, that it needs to be fixed in order to allow Canadian generic drug companies to send life-saving medicines to people who so desperately need these. This is precisely what the bill does. It simply fixes the existing regulations that are mirrored in red tape. The bill unites that necessary red tape that is preventing CAMR from fulfilling its own mandate. CAMR is supposed to allow for export of generic versions of pharmaceuticals to developing countries, but it is broken, Mr. Speaker. And now New Democrats are proposing this practical solution to fix this for once and all. Generic competition is the single most important factor in reducing the price of medicines for these people. In the case of some HIV/AIDS drugs, generic competition has reduced the prices by as much as 95%. We know that gains have been made in the treatment for people living with HIV/AIDS, but I want to say this again, only 1/3 of those who need treatment actually receive it. And in some countries, access to treatment is being reduced rather than increasing. And now we know that when it comes to HIV/AIDS, Mr. Speaker, treatment is the prevention. Research has shown that early and aggressive treatment of HIV-infected individuals with antiretroviral drugs, also known as ARVs, reduce the transmission of disease by 96%. Mr. Speaker, Bill C-398 is one tool at our disposal to make sure that affordable treatment reaches as many of the world's poor as possible. We in this House have the power to make this happen, and I would strongly urge and argue that we have an obligation to make this happen. That is why I urge members across the aisle to urgently pass this bill, Mr. Speaker. It is my sincere hope that members from all parties will support this legislation. Mr. Speaker, this is a moral imperative. It's a matter of conscience. It's a matter of compassion. It's basic humanity, Mr. Speaker. Mr. Speaker, what this act proposes is a reasonable one license solution that would allow generic manufacturers to supply approved medication to any eligible country on the WTO list of countries that are in need of affordable medicines. But, Mr. Speaker, let me be very clear. This need is dire, and CAMR is broken and is failing to meet its goal. In 5 years, CAMR has been used only once, to supply a single order of 3-in-1 AIDS medicine to Rwanda. But this one incident required years of effort and was so complicated that CAMR has not been used since then. Mr. Speaker, this needs to be fixed. It has been taken far too long for a solution that we have already in place, that we can provide those drugs to those nations. In fact, this bill already passed in the House of Commons with a healthy majority in March of 2011, but sadly it died on the order paper in the other House. I respectfully again ask my colleagues at all sides of the House to help make sure that this time this bill passes in this House. And it needs to be passed in an urgent way, Mr. Speaker. And it just makes sense for me. That is why 80% of the Canadians support this initiative. That is why organizations such as UNICEF, World Vision Canada, the United Church of Canada, the Federation of Medical Women in Canada, the YWCA, and the Canadian Federation of University Women support this initiative. And, you know, it's not going to cost any money to taxpayers either, Mr. Speaker. This bill will not cost a cent, a penny to the taxpayers. We can provide access to affordable quality medicines to enable people in Africa, African countries, and other developing nations to survive and thrive without costing Canadian taxpayers a cent. Also, the market for medicines in poorer countries represent a very tiny portion of global sales for the brand name pharmaceutical. For example, the entire continent of Africa totals about 2% of their sales. And Canada's largest generic pharmaceutical manufacturer, Apotex Inc., has publicly committed to making a 3-in-1 AIDS drug suited for children in developing countries if CAMR is reformed, Mr. Speaker. CAMR reform is also fully compatible with the World Trade Organization's and regulation and treaties. The WTO has repeatedly stated that compulsory licensing to increase the supply of affordable medicine to poor countries is in keeping with WTO regulations, and international legal experts, in fact, endorse this position. Mr. Speaker, we can help restore Canada to a position of leadership in terms of our response to global public health position. Public health crises, including HIV/AIDS, TB, and malaria, represent massive human, social, economic burdens for developing countries, significantly impeding their development, Mr. Speaker. Only 1/3 of the patients living with HIV/AIDS who need treatment receive it, and I've said that children are the most underserved in this group. The need for treatment is increasing, yet funding is shrinking. The Global Fund, which helps the HIV/AIDS Fund, TB, and malaria, is under a particular strain, Mr. Speaker. CAMR reform will encourage further generic competition, which will in fact enable the Global Fund and governments to strengthen their limited dollars further. Speaker, this bill is one tool at our disposal to make sure that affordable treatment for diseases such as HIV/AIDS, malaria, and TB will reach as many of the world's poor as possible. We have made a promise to developing countries when we established CAMR. We have failed in that regard, in that promise, Mr. Speaker. It is time to right the wrong for the sake of those who are suffering without the medicine they need to so badly. For developing countries that are in desperate need of affordable medicines to address public health crisis. Mr. Speaker, I again want to urge this House to unite on a global cause that we can make a difference in many parts of the country, in many parts of the world where help is needed. And I urge my colleagues, my Conservative colleagues, my Liberal colleagues, and all of the members of this House to vote in this favor, that we can be compassionate, that we can look after those that are in need of medicine throughout the world, Mr. Speaker. Thank you very much, Mr. Speaker.
Reprise du débat, resume.
The honourable member for Surrey North.
Thank
Thank you, Mr. Speaker. Bear Creek in my community of Surrey is a prime example of critical salmon habitat that is under threat because of this government. The Conservatives have used their monster budget to systematically undermine and dismantle environmental protections for our rivers, lakes, and streams right across this country. Urban waterways like Bear Creek are under pressure from development and related pollution, and legislation that traditionally helped to protect these sensible areas is being gutted by the Conservatives. Mr. Speaker, local governments are struggling to fill the gaps, but they cannot do it alone. Last week, I met with officials from the City of Surrey, and they said very clearly that they rely on strong legislation and enforcement from the federal government to do their jobs. It is time for the government to stop making policy at the whims of their oil industry friends and start standing up for the needs of our community.
The honourable member for Yellowhead.
Well, thank you, Mr. Speaker. Our government continues to stand up for the interest of Alberta.